Public health informatics ensures that systems implemented support program workflow, that we can translate policy into a usable work product that supports outstanding healthcare delivery. We design solutions to keep accurate data collection and sharing of information seamlessly, accurately, and timely in order to support our communities. This allows us to comply with mandates and promote fiscal responsibility. We also provide data engineering, business intelligence, and analytics. And this is all about the people, the processes, and the data.
My definition of public health informatics is connecting people to technologies, information, processes, and policy in a way that facilitates the work that we do every day.
Is that we work between information technology, finance, which processes our claims and does billing, and a multiple group of health department programs, as well as programs that are in the community support services.
I think about the gathering or collection of information using some secured type of device that allows the ability to access the information by the consumer to be able to promote the health of a given population.
I feel like informatics, it really is the nice bridge between our clinical staff and our technical resources. Often they don't, in my experience, they don't always communicate well. They speak two different languages. So informatics is able to come in and almost help translate between the two entities. And when we have those of us like myself who is a nurse for several years, we're able to come in and say, well, this is how I would do it. This is how it's going to work best for the staff member, and be able to utilize that knowledge and experience to help make changes more accessible and easier to understand and navigate once those changes occur. I think
the Agile framework has historically been a model for software development, but Informatics in Mecklenburg County adopted this model because of the need to implement and get feedback quickly to be able to evolve the programs. We try to improve on the next iteration in a very short period of time. With all of these changes, Public Health Informatics used the ADKAR model of change to guide us through our operations: awareness, desire, knowledge, ability, and reinforcement. We start off with developing awareness of this change.
For technology change management, we meet with all of our informatics staff and the IT folks who support the electronic health records weekly. At that point, we review all the open case management or cases, tickets, service requests. That allows us to, in turn, all know the status and prioritization, and that lends to excellent awareness and communication. Folks know who's supposed to do what and how these things are going to get done. What we do is help folks stay on the same page, and that lends itself in turn to supporting excellent public health.
And now we bring the most important aspect to any change, and it's the people. Understanding their needs and wants is an essential part of change management.
And if I know the change that is likely to be forthcoming, I usually have somewhat casual but directed conversations with people to just try to collect an idea of how they feel about a certain change. And when I bring the suggested change up, I also ask for any ideas that they might have toward the change. I pay attention and ask about what's going on in the department at the time, just recognizing that people can become change fatigued very easily. So even if a change is really important in the organization, the timing of it could be wrong. It helps me understand motivation and motivating factors for individuals. And I like to always offer people an opportunity to share freely. And I can take that information back to the team, and then we can start to work on a process that considers what it would take for a person to want to do something that's involving change to how they normally do their work.
The best way to engage individuals is to ensure that understanding and knowledge of this change. Our school health EMR committee has evolved from a design decision group to providing a more holistic approach to their team.
Our school health EMR committee not only facilitates change within the system and accurate ways to document and capture appropriate data, but we also take the time to make sure that we're educating our staff, that we're increasing their knowledge base. For example, when we realize there's an issue with how our staff is documenting or a knowledge deficit that they're not sure how to put something in a certain way, we take the time to create user guides, to do videos, to make sure that they're able to access that information and broaden the way that they're able to utilize the EMR. Often we even have virtual pop-in sessions where they can come in and get a refresher or ask a question that they may have thought was dumb. And it's just wonderful because not only are we able to update them on stuff like that, but we've also been able to take the time to update them on other things that they will not only utilize with school health, but in other fields.
With the awareness, desire, and knowledge at hand, Informatics evolved from face-to-face to virtual, video recorded training to one-on-one sessions. All of this to expand people's ability to respond to the change.
I think that within informatics, the ability to be able to help the consumer understand how to use systems to be able to capture that information or that data that then would lead into being able to help with better decision-making processes along the way. That's the importance of how the structure for informatics works as it pertains to ability within the ADKAR model.
Most organizational changes fail because of the lack of follow-up. This is where the last part of the ADKAR model of reinforcement come into play. Informatics grew its analytics arm to manage the data engineering and analytics more effectively for public health. And this allows us for actionable data.
When it comes to data, we really try, when looking at the data, it really reinforces all our decisions that we're making because we're seeing from the ground floor what is our data telling us about our community and what decisions do we need to drive. And that further reinforces even future decisions.
Easier way of them capturing data for us to be able to create dashboards for them to be able to analyze and be able to present, show them how to present and understanding the dashboards that we create and how it affects the public in general.
In 2018, Mecklenburg County Public Health Informatics was reestablished with a new vision and strategy. Timing was perfect. It prepared our team to address the COVID pandemic and the changes that it brought to the program and to the healthcare service delivery.
So to me, the most important thing that I feel Mecklenburg County Public Health Informatics has done is our whole response to COVID. We went from a very small communicable disease staff to training school nurses and clinic nurses and nurse practitioners and outside temporary agency people to learn how to do case investigations, to creating our own EMR, which then quickly pivoted into mass registration for our immunization efforts, phased into appropriate data entry and how to facilitate that in a timely fashion. And I feel like that's been such a great accomplishment because not only did it take care of us during this pandemic, but we can also transition this into any other mass event which may occur in the future.
And when it pertains to how that is important within public health, I think it fosters active surveillance. And it also supports those fundamentals within the essentials of public health, like assurance, assessment, and policy development, to be able to mitigate the risk and, more importantly, improve upon the health of a set community.
On our team, we take the information and bring it back to leaders and people that need to use that information for decisions. It affects at the highest level for things like our budget, our goals for a public health and healthy community. And it also helps at the frontline level for staff that use the technologies and the information that we help them with to do their daily work. We're constantly translating and connecting the dots and bridging gaps between policy, technology, and the work demand to what's a usable product for the people that are doing the work in public health.
In that it maintains our compliances and mandates that are specific to public health arena. And it also helps us accomplish our goals, which is to deliver public health services to our customers and community.
When I think of it, I think of the kind of intersection of computer science and information technology and marrying that with public health research and learning and all the other things with public health, and seeing how to drive innovation and really impact real-world situations.
Integrating public health informatics as the primary driver for Public Health 3.0, Mecklenburg County Public Health addressed short-term goals of system integration, data warehousing, and data availability. Long-term goals of EHR efficiency as we go through various transitions, data governance, and a sustainable response to emergency situations are managed through an agile framework with a very solid change management control and design. Thank you very much for listening to this presentation. If you have any questions, please reach out to the Mecklenburg County Public Health Informatics Program. Have a great day.